Welcome to Peds News. Today we are going to discuss a topic that I think brings positivity to everyone: therapy animals. For our research project, we are asking the following question: do therapy animals have a positive impact on the pediatric population in the hospital? Countless studies have been done on this topic, and most involve therapy dogs because dogs just seem to be perfect for it. They have a natural affinity towards helping people. We've discussed a couple of articles between the four of us, and Tiffany's going to start us off. Tiffany?
Thank you, Kara. I'm going to spend just a few moments talking about education with regards to therapy animals. Who needs to be educated about therapy animals? Well, ultimately, I believe we all could benefit from being educated. But as nurses, it is important to have that information so we can pass it along to our parents of our patients who could really benefit from animal therapy. The CDC states that childhood mental illness and obesity are significant public health problems in the United States. Because both conditions start in early childhood, early intervention and prevention is key. An early intervention could be a therapy animal. Now, I know as a parent, the idea of caring for another living thing can be quite stressful. But here's another education tip that you can pass along. Animals can promote a sense of responsibility in children, as well as increasing their physical activity and promoting self-esteem. I'm going to leave you with another thought. The CDC found from a mental health standpoint, children aged 7 to 8 often ranked pets higher than humans as providers of comfort and self-esteem. So in conclusion, just know that education is available about animal therapy online as well as at MUSC here locally.
That's some really great information. We've also got Tamara, who's done a little bit of research as well. Tamara, why don't you tell us what you've got?
The nursing profession is known for seeking other interventions to help patient reduce symptoms, to promote healing and wellness. Studies have shown systematic benefits of animal-facilitated therapies to reduce pain, decrease psychological distress, decrease anxiety, and break communication barriers. In one study, Dr. Corson, a professor of psychiatry and biophysics, recalled a case of an adolescent that was unresponsive to treatment. When a therapy dog was brought into his room, the patient began to speak. A larger study done in an outpatient pain management clinic showed that 23% of the patients had a significant reduction in pain that had a pain score of 5 or greater. Last but certainly not least, one interesting study focused on the pediatric oncology unit where 89% of the children who received animal therapy had increased independence and appetite, decreased fear and pain from treatment and procedures. These patients can be seen in different settings, such as acute care, hospitals, long-term care, and mental health facilities.
And finally, Christina.
How could technology be used to do further investigation? As you all may know, technology plays a huge role in healthcare. To further investigate the effects that animal-assisted therapy can have on a pediatric patient experiencing stress due to medical procedures, we must use technology to our advantage. Using medical equipment to continuously monitor patients' vital signs, such as blood pressure, it allows us to see the potential benefits of animal-assisted therapy. An experiment was done using a group of hospitalized children from the ages of 3 to 17. The dependent variables included vital signs and pain. The results said that there was a decrease in pain and blood pressure.
Wow, I am blown away by all this amazing information. I had no idea that so many things could be accomplished just from having a dog around, or a cat, or a bird. Really, any kind of animal can be a therapy animal depending on how the handler uses it. We'd really like to thank Lucky, who you'll meet in a minute, for letting us do a little bit of an interview. We got some really great information, and his handler Al has already done this great little clip for MUSC, who he works for, and he's allowed us to use it in our project. Let's watch.
Okay, come on, we gotta go get to work and see patients. Hi. Like to see a therapy dog? Lucky is a 4-year-old schnoodle, which is a schnauzer poodle mix. I get the satisfaction of seeing the patients react to him, and you know, during very stressful times, they'll feel better just by having him, you know, close to them. Very few things have I done in my life that have been what I would call reacting or being socializing with people as far as making them feel better. I've been in sales for most of my life and everything's been working, so now I'm volunteering and I feel some satisfaction to that later on in my life. Hey, how you doing? Lucky's just actually going to be falling asleep in a minute, I can tell, which is his MO. We've had a couple of cases where he's gotten on next to the patient that's had high blood pressure and a higher heart rate, and within a few minutes the blood pressure goes down and the heart rate goes down. He's worked with a couple of kids, one child which didn't want to talk, and we got him to talk, and another child that didn't really want to walk. We actually had this child on the 7C actually walking around with the dog on a walker.
Lucky also has a Facebook page, so friend him and find out what you can do. I think it's safe to conclude that pet therapy really does have a positive impact on the pediatric population, especially in the hospital. As a nurse, be sure and familiarize yourself with all the tools at your disposal. And if you have a resource available, use it.